you for tuning in to listen again. I know it's a nice sunny evening, well it certainly is down here, so thank you for coming to your computer to listen to me. And of course thank you to Pedigree for sponsoring these two webinars. They are completely committed to education, not only of the general public but of vets and nurses as well, and I'm very happy to be able to work alongside them. So what I'd like to try and cover this evening is, as Anthony described, the importance of client compliance, and that doesn't only cover getting clients to perform the home care, but how we can get them to go along with our recommendation in the consulting room. So my computer has decided to freeze, so I can't move slides at the moment. Oh, there we go. So we use the word compliance quite a lot, and you know, it's bandied around a lot, and we need to really understand what compliance is. And essentially, in medical terms, it's the extent to which a person's behaviour coincides with medical advice. Now, that might be to take a pill, a medication, it might be to change their lifestyle, or make certain behavioural changes, you know, take more exercise, for instance. And the World Health Organization in 2003 basically made a statement that if we can improve compliance, then that's going to have a much greater impact than any improvement in the actual medical treatment. So just getting patients to take their medicine can have vast improvements. The problem with this kind of view is that it's a very paternalistic sort of situation. It's a very authoritative situation. The doctor says, you must take this tablet 3 times a day, and that patient is not really involved in the decision making. They're told what to do. If they don't do it, they can then be labelled non-compliant. And there may be many reasons why patients are non-compliant. I mean, we know, for instance, with our clients, some old people with arthritis in their hands just cannot get the tablet pots open. And that may be a reason why they can't give their pet the tablet, because they can't physically do it. So there is this sort of concept of concordance. And here the theory is that it's more of a mutual relationship between the professional, so the doctor and the patient, or perhaps the vet and the client. And you have an active discussion. You kind of work as a team, and you negotiate so that you can achieve an outcome that you're both happy with. So in dentistry, as we said at the start, what I'd like to try and cover is getting the client to say yes. When you recommend treatment under anesthesia, we want them to say yes. We don't want them to go away and think about it. And we don't want the situation that I hear so often where vets say, well, we tell the client every year at booster time to come in, and they never come in. That's what we want to try and avoid. And then, of course, as you know, periodontal disease is not something that we can fix or cure unless we extract all of the teeth, which I wouldn't necessarily recommend. It's a disease that we can maintain and try and manage. And we do that with our home care program. And if you do this, if you achieve compliance or concordance, then everybody wins. The patient receives the treatment that it needs. The client actually perceives a better level of care and a stronger bond to you, the vet. And of course, the practice will benefit financially as well. So there's many reasons why potentially compliance is low, and when I sort of do talks like this and I ask vets why they think compliance to dentistry recommendations is low, these are the typical examples that we come up with. So the client often doesn't perceive that there's a need. Clearly the mouth is hidden. The only time often clients will see in their pet's mouth is when they yawn, or when they're sort of sitting on their lap and they can get a good smell. So the mouth generally is hidden. Perhaps there's anaesthetic concerns. You know, clients seem to have a big fear of anaesthesia in general. Maybe it's the cost that puts them off. Maybe it's the fact that they don't have insurance, or perhaps insurance doesn't cover dental treatment. And of course, we all know that pets still eat, and they don't appear to be in pain. These are my 2 cats on the right, Eric pretending he's a lion just about to eat some grass, and Elliot just deciding that he quite likes his cat food, which is Royal Canin, by the way, just to please Mary Louise. So do we contribute? And what I mean by that, is it ever our fault as the veterinary professional? Well, here's some examples that I'd like you to consider. Here's some history. Terrible teeth. Calculus grade 2, gingivitis grade 2, appears to have some retained deciduous teeth, but will need a dental at some point in the next 6 to 12 months. So why doesn't it need treatment now? Here's another case. Fit and well, teeth slightly dirty, dental in the next 12 months. Query, arrange at the next booster. So clearly we're picking up disease, but it seems that the recommendation is a somewhat tentative recommendation. Here's another example. Moderate calculus and gingivitis in the maxillary arcade. So not mild disease, but moderate disease. In our action plan, we've got that dental disease needs to be addressed, but when we get to the plan, again, we'll need dental eventually. So why don't we need the treatment now? We're starting flea treatment for the cat, but apparently the dental treatment can wait. So how about this cat? Does this cat need treatment in the next 6 months? We've got gingivitis there. We've got moderate levels of calculus on the upper 4th premolar and the lower 3rd premolar. How do we know that there's not a resorptive lesion underneath that tartar? You know, we don't until we get the cat anaesthetized and examine it properly. What about these two cases? And these are the slides I put in for Anthony. You know, we've got quite an obvious area of inflamed skin there. There's no way we would suggest leaving that for 6 months till we treat it. And there's a flea. It doesn't particularly look like a flea, but there's a flea on the right. You know, there's only one, so why don't we wait 6 months and treat it when we get a few more? You know, of course, it's silly to say. We're not going to say that to the client. We're going to recommend treatment now for these cases, but why would we suggest perhaps this cat doesn't need treatment immediately? Now, if you want to be successful in making a recommendation, we know that there are certain things that are involved, and the person needs to trust you. And you also need to be empathetic. You need to be able to put yourself in their shoes and see things from their point of view. And those two things are very much unconscious. If we trust somebody, we don't really know why we trust them. We get a sense that we do trust them. And again, if somebody is empathetic, you can't really put your finger on why they're being empathetic, but you just get a gut feeling. But then we come to the logic side of things, and that's the explanation that you give, the words that you use. And that's very much a conscious thing. You know, when a doctor's explaining to me what's going on with me, the words that he chooses, the way he explains it, that's the logic. But whether or not I trust him and whether I feel he's empathetic, those would be very much unconscious feelings. So the logic, we all know that vets are not taught huge amounts of dentistry at university, but this is essentially where you need to take you know, a proactive role in your own continuing education, which clearly you are at the moment. You need to make sure that you fully understand the common diseases that we see in small animal practice. Do you fully understand periodontal disease? Do you understand the progression from gingivitis to periodontitis? Do you know what a periodontal pocket is? You know, those kind of things. Because if you don't understand, there's no way you can adequately explain it to your clients. And I would strongly recommend, if you've never done a wet lab, that you consider doing a wet lab as well, because getting the hands-on skills is really important. And if what somebody is saying makes sense, if the explanation makes sense, we can then validate those gut instincts. So if we trust somebody and what they're saying makes sense, we're likely to follow their recommendation. So empathy is this ability of being able to put yourself in someone else's shoes. And the first thing you need to do to be empathetic is to acknowledge the bond between the pet and the owner. And we all know that there are different clients out there, and some of them we think are a little bit crazy. And I know most of these people. One was a client that I saw in South Africa with one of my colleagues. The lady on the bottom right helped me in designing my website, so she was quite happy for me to use that photo, and she would quite freely admit that she is fairly crazy about her cats. And so we need to acknowledge that bond. And you know, many clients will say to us, well, I don't